Have you ever been in a situation when you wanted to fall asleep but couldn't do that? This condition is called insomnia. Insomnia is a sleep disorder in which you have trouble falling or staying asleep. Acute insomnia is short term and lasts from a couple of nights to a few weeks. Chronic insomnia is long term and lasts at least 3 nights a week for 3 months or more. There is also a light form which is called transient insomnia. It occurs when symptoms last only up to 3 nights. But why do people have insomnia? To understand this, we should first notice that there are 2 types of insomnia, primary and secondary. Primary insomnia means that your sleep problems aren't linked to any other health condition or problem. Causes of primary insomnia include stress related to big life events like a job loss, the death of a loved one, divorce, or moving to a new place of living. It may be caused by the things around you like noise, light, or temperature, and also changes to your sleep schedule like jet lag, a new shift at work, or bad habits you picked up when you had other sleep problems. Secondary insomnia means you have trouble sleeping because of a health condition, pain, medication, or substance use. Causes of secondary insomnia include mental health issues like depression and anxiety, pain or discomfort at night, caffeine, tobacco, or alcohol use, hyperthyroidism and other endocrine problems, and other sleep disorders like sleep apnea and restless leg syndrome. Also, there are some medications that can cause insomnia in some patients as a side effect, such as medications for colds, allergies, depression, high blood pressure, and asthma.
How it may affect brain. The sleep-deprived patients have weakened neural connections to and from thalamus, the area of the brain that controls sleep and consciousness. It also impairs brain functions such as memory and decision-making. Insomnia leaves the brain exhausted and unable to perform the duties that are necessary for it to keep you happy, healthy, and productive. Some of the effects that insomnia can have on the brain include the inability to concentrate, short and long-term memory loss, troubles with decision-making, and mood swings. Other risks of a sleep-deprived brain are hallucinations, impulsive behavior, depression, paranoia, and suicidal thoughts. Thalamus during insomnia. Increased thalamic activation in nuclei related to sensory processing and/or decreased activity within the reticular nuclei during sleep could lead to more sensory information reaching the cortex and thus greater sensory processing perisleep onset or during sleep. Presumably, this would be related to the tendency of patients with insomnia to be hyper-responsive to environmental stimuli, which in turn may account for patients' difficulties falling and staying asleep and/or the perception of shallow sleep. In other words, this might be the neurobiological basis of patients' reports of being light sleepers. Neurobiologic implications for insomnia. Reduced activity during wakefulness within the adrenocinergic regions of the basal forebrain, overall decreased cortical arousal during wakefulness, increased activity during the sleep period within the thalamic nuclei related to sensory processing, and reduced activity within the sensory gating nuclei, overall increased cortical arousal during the sleep. It is important to understand that lack of sleep may affect our whole organism. Our bodies and brains need to sleep so they can repair themselves. It's also crucial for learning and keeping memories. If insomnia is keeping you awake, you could have, first of all, a higher risk of health problems like high blood pressure, obesity, and depression, a higher risk of falling if you're an older woman, feeling of anxiety and grumpiness, slow reaction time that can lead to fatal accidents such as car crash.
How to overcome insomnia. Treatments for insomnia can be medical or behavioral. For chronic insomnia, you will need treatment for the conditions or health problems that are keeping you awake. Medical treatments for insomnia include prescription sleeping pills, antidepressants, sleep aids, antihistamines, melatonin, and Ramilton. But we know that every third person have at least light form of insomnia, and behavioral treatment of insomnia might be very helpful for majority of people. We would like to give some tips for leaving insomnia behind and getting better sleep without taking any pills. First of all, set a sleep schedule. Going to bed and waking up right around the same time every day will help your body and mind to get into the swing of an ideal sleep-wake cycle. Second, avoid any kind of caffeine after 2 in the afternoon. Third, Avoid strenuous activity, strong physical activity at least 3 hours before going to bed. Also, try to sleep in complete darkness so that melatonin can be produced effectively. Also, avoid bright lighting a few hours before heading to bed. And finally, take some time to relax before sleep. Read a book, take a warm bath, or even practice some light yoga moves.